Welcome, everyone. My name is Meredith Turner, Rachel Carson College, class of 2009, and president of your UC Santa Cruz Alumni Association. So here we are at our first event of the 2022 Alumni Week, and it is my absolute pleasure to welcome all of you today. I hope to see you online and in person for the first time in several years throughout this week of exciting programs. This event kicks off Alumni Week, and we have many more events, both virtually and in person. So if you haven't already, I encourage you to check out the full lineup. I want to personally extend an invitation to join me this Saturday at 4 p.m. in the Cal College courtyard for the Cheers to 30 Years event, where we will be honoring the 30th anniversary of the Alumni Association Scholarship Fund, which has provided almost 800 scholarships and distributed $1.8 million in student financial aid for our UCSC students. So I hope you'll join me in that celebration. Today, we have a chance to learn from three incredible alumni from our science communication program. Tonight's topic will explore journalism and data during the pandemic. So let me introduce Erica Hayden, the director of the science communication program here at UCSC. Before joining UCSC, she worked for the news section of Nature, reporting on biomedical research, emerging technologies, scientific trends, and ethics in science. Her reporting on the Ebola crisis from West Africa received multiple national honors in 2014 and 2015. Erica majored in biology at Stanford University, which we'll forgive her for because she's now made her way to UCSC, where she began her journalism career by writing for the Stanford Daily and the Stanford Alumni Magazine. She's also worked at Newsweek in New York, covering science, medicine, and breaking news. Erica, I'll hand the program over to you.
Thank you for that very kind introduction, Meredith. And I'm so pleased to be here with all of you tonight to talk about journalism and the COVID pandemic. The COVID pandemic has spurred an unprecedented demand for accurate science communication, and journalism has been critical to helping society understand and react to the COVID pandemic. But how do journalists separate facts from misinformation when scientific knowledge is changing constantly? And how do journalists remain focused when they themselves are living through the disruption caused by the pandemic? Three alums of UC Santa Cruz prestigious science communication program are going to share tonight what they have learned by covering the biggest science and health story of our lifetimes. And before I introduce them, I want to share a few details about the event for tonight. We are using a webinar tool, so there is no chat function. We will have an opportunity to answer your questions at the end of the program, and we invite you to submit your questions into the Q&A box at any time. You should see that on your screen. Tonight's event will also be recorded. So now I'll introduce our alum panelists for you. They are all graduates of the SciComm class of 2014. So they were classmates, and now they're all journalists who have covered the COVID pandemic in various ways. First, we have Seth Akpan, who runs the Health and Science Desk at WNYC Gothamist. He was previously an editor at National Geographic, where he worked as a science editor overseeing its COVID-19 coverage, in addition to other topics in science, health, and technology. Before that, Seth worked for more than 4 years at PBS NewsHour, where he co-created an award-winning video series named Science Scope. He shared a 2020 Emmy for the PBS NewsHour series, Stopping a Killer Pandemic. And in 2019, he received a George Foster Peabody Award for the PBS NewsHour series, The Plastic Problem. He has also worked for NPR, Science News Magazine, Science Magazine, KUSP Central Coast Public Radio, the Santa Cruz Sentinel, and as a writer at the Center for Infection and Immunity at Columbia University. He holds a doctorate in pathobiology from Columbia and is an alum of the science communication program here at UC Santa Cruz. Julia Calderon is a senior staff editor for Well at the New York Times. She is currently based in New York City. Before joining the Times, she was an associate editor for health and food at Consumer Reports, a science reporter at Business Insider, and completed internships at Scientific American, NASA, KUSP, and the Monterey Herald. In 2021, she and a large team of journalists at the New York Times received the Pulitzer Prize for Public Service for their work in tracking the coronavirus. Julia has a graduate degree in science communication from our program and a bachelor's in neuroscience and behavior, also from UC Santa Cruz. In a previous life, she worked in biotechnology, designing DNA-based sequencing tests for organ transplant patients. And finally, we have Nicholas St Fleur, who is a general assignment reporter and associate editorial director of events at STAT. He's also host of the podcast Color Code. He covers the intersection of race, medicine, and the life sciences, and was previously a Knight Wallace reporting fellow for STAT. He won the 2021 Everett Clark Seth Payne Award for Young Science Journalists. Prior to STAT, he was a freelance science journalist in the San Francisco Bay Area, covering archaeology, paleontology, space, and other curiosities of the cosmos. He previously worked for the New York Times and the Atlantic, and he interned at Scientific American, Science Magazine, NPR, and the San Jose Mercury News. He received his bachelor's degree in biology from Cornell before coming to the science communication program here at UC Santa Cruz. So welcome, everyone. So glad that we have all of you distinguished alums here tonight. I'm going to start off by sending a few questions to Con, and then he's going to take over moderating the event for the evening. So Con, my first question for you has to do with the NewsHour series, Stopping a Killer Pandemic, for which you won an Emmy. You produced this series before the COVID pandemic even started. So what led to the very prescient choice to cover the topic when you did, and did things unfold the way you thought they would after reporting on that series?
Yeah, I think it certainly feels prescient in hindsight. That whole team, I think we were mostly just aware of the fact that we're always just a few years away from a major flu pandemic, and I think that's still true today. And so we just wanted to break down what goes into a pandemic, just down to its essential parts. So, the first story was just about the cycle of flu pandemics and why we keep having them. Then the second story kind of looked at the surveillance around the issue, whether or not it's researchers or who are heading out to the beaches of South Jersey to collect bird poop to see how flu viruses are kind of merging and mutating and migrating birds, or whether it's, going to a Midwestern county fair to conduct surveillance in pigs to see how, swine flu might emerge in those animals. And then the third story was about the chances of a universal flu vaccine and what it could mean for healthcare. And I think, each of those stories kind of fit the theme or themes that we've seen throughout the COVID-19 pandemic. And I think even to some ways, the chronological order of things that sort of emerged with the COVID-19 pandemic, right? Like, what is it? How is it sort of being tracked over time, and like how can we treat it? I think that was mainly the thrust of why we did that series.
Right. And yeah, I mean, vaccines have become such an important part of this current pandemic as well as trying to figure out where it's even coming from, right? That's not still completely resolved. You also, going to this theme of how the pandemic has, how it's been covering the pandemic for all of you as you're living through it yourselves. You canceled your wedding reception after testing positive for COVID in December, and then you wrote a story about your experience with so-called mild to moderate Omicron. Why did you decide to share your story with your readers, and what was it like to come down with this disease that had consumed your coverage for the past year, and did it change how you covered it or your understanding of the pandemic?
Yeah, I mean, it felt terrible, even though it was considered mild to moderate. I think, my approach to science news stories has always been, can I tell a story that nobody else has covered? I think that comes from actually my first internship after the SciComm program at Science News Magazine, which essentially at Science News Magazine, there's a beat reporter for every single topic, right? So astronomy, insects, genetics. And so what I really learned there, and I think also what I learned in the SciComm program, is to try to tell the story that nobody else has told. And, when I caught COVID, it was at the end of December, and I think people still didn't really know what to expect from Omicron because, there was so much immunity, so many people were fully vaccinated, a lot of people were boosted. And so I think, when I caught it, I was like, oh, there's kind of a moment here to describe to people what it actually feels like, because as I was sitting like laid up in bed and having like a telehealth appointment with my doctor, they were like, oh yeah, you're coughing all the time. Yeah, your blood oxygen is falling a little bit. Yeah, that's mild, mild to moderate, like just like rest. And I was like, I don't think people realize like just how bad these infections can be, even if it's so-called mild to moderate. Because I think at that point, most people hadn't really caught COVID, right? Because we had just sort of started reopening to the public. The Delta wave had sort of abated. We knew that this winter wave was probably going to be intense, but obviously looking at the record numbers that we saw, we didn't expect it to be quite this intense. And I don't know. Yeah, I really, I just really hadn't seen a story that had walked through the symptoms. And so I just felt the need to do it. I mean, I felt extremely crummy after I wrote this story. And in hindsight, it probably wasn't the best thing to do for my health, but it just sort of seemed like the moment was there. And I think the experience overall was like it was a blessing and a curse, right? We had to cancel the wedding, which was actually like the third wedding I think that we had canceled during the pandemic, or no, the second wedding that we had canceled during the pandemic. And which is a bummer. I think like so many people, it meant missing out on memories with families and friends, and I think that's just something that we've all been sort of going through for the past 2 years. And I think people are really ready for that to be over. But it was also a blessing in a way in that, I tested positive on a rapid, like about an hour and a half before I was supposed to head to the airport to travel across country to see my senior citizen in-laws. And so, the situation could have just been really, really bad if I hadn't tested. And I think also the wedding too, given the timing, we were probably hoping too much for the best. And so I think canceling it was ideal for like public health in the end.
Right. So now I'm going to turn it over to you, C-Con, to moderate. And I noticed we do have some questions coming in the Q&A. So we'll hold those for the Q&A session afterwards, but keep those questions coming. Thanks so much.
Yeah. All right, Julia, Nick, now it's time for the red table talk portion of the evening. Hope you're ready to get into it. Julia,
that's what I'm here for. We come prepared.
Julia, I'm gonna start with you. So you were tapped to work on the New York Times COVID tracking project during the spring and summer of 2020, while also living through the pandemic in New York City. I want to ask, what were those early days like? How much time did it take to sort of get the project off the ground? And at the time, did it feel like, oh yeah, we're building a tool that everyone is going to be looking at every single day, because like the CDC is a hot mess right now.
Yeah, I don't think it would be an exaggeration to say that those were some of the both darkest and most humbling and rewarding periods of my life. Frankly, it was a terrifying time. I was tapped in early April 2020 to work on this project. At the time, I had already been covering the pandemic for the parenting desk at the Times. I was editing our health and science coverage. And, I had assigned the first story about the strange flu-like illness circulating in Wuhan. So by the time April came around, I was already, starting to feel a little bit burned out already, and we were just at the beginning of the pandemic. And so I got an email from Carolyn Ryan, who's the deputy managing editor of the Times, at 5:30 p.m. on a Friday. And I was asked if I could drop everything I was doing on parenting and join this totally new team starting on Monday, basically. So it was like, we need your help. We're assembling this giant team of journalists to take on this massive tracking effort. So, it was a very overwhelming time. I'm in a very small 500 square foot studio apartment in Brooklyn, 5 blocks away from Brooklyn Methodist Hospital, so just hearing the sirens blaring seemingly every couple minutes, going on walks, seeing the body trucks piling up outside the hospital, grocery store lines around the block. I was working very odd hours. The tracking project was a nearly 24/7 project. So some days I would be working 9 to 5, some days I'd be working 2 to 10, 4 to midnight. And at the same time, there were the George Floyd protests in Brooklyn. And so there was a curfew at one point at 8 p.m. And so sometimes I'd get off work at 8 or 9 or midnight and not be able to leave my apartment. So it was a very isolating time. But at the same time, it was what got me through it was just knowing that I'm providing this valuable service to readers, and millions of people are coming to our site every single day. And, we were providing a service for readers that really the federal government was not providing. We were filling in the gaps in this data hole. And it was just us and, a few other trackers at the time. There was Johns Hopkins and I think the Atlantic had a tracker at the time, and then the New York Times. And we were just providing this really essential service for readers that, the federal government was not providing.
And then just a quick follow-up on that, the project was part of the Times package that received the Pulitzer Prize. Hey, I was wondering, what does that feel like? Does it, what does it feel like?
You'll know in time.
I want a Pulitzer, how monumental does it feel to have just been so foundational to what people were learning about the pandemic?
Yeah, I mean, in a way, I just felt incredibly lucky to be at this institution that, had the resources to put behind this massive tracking effort. I don't think a lot of journalistic publications right now have that sort of money to say, hey, we're going to take 100 journalists and put them on this one project. And it's literally their job is to physically count every single death and COVID case in the entire United States. So I just, I felt very lucky to just be sort of in the right place at the right time, which is very weird to say, to work on this project. And, like I said, it felt really amazing to be filling this hole, that in the data and just giving people this resource. And, when we won the Pulitzer Prize in 2021, we were all still remote and not in the office. And, so it was kind of like, it was very exciting, but it was also just like, we're still in this pandemic, things were getting bad, this was during the Delta wave. And so it felt weird to celebrate while we're also, still gonna have to be tracking this thing. The project is still going on. I'm no longer on the tracking project right now, but they're still doing it. They're doing it every day. There's trackers for literally everything. So who knows how long they're gonna be doing it.
But you did celebrate though, right?
I went out to a socially distanced drink, then back to work.
Okay, so Nick, I want to pivot to you. You also won an award in 2021, the Everett Clark Seth Payne Award. And one of the stories that won that award focused on Black Panther actor Chadwick Boseman and what his death from colon cancer sort of reveals about so-called hotspots of colorectal cancer. You and I famously saw Black Panther the night that it opened.
Famously. we were at a conference. We were like, yeah, you know what we should do tonight instead of like some of the events? Like, let's just watch Black Panther.
Yeah. After like
great.
9 to 10 hours of reporting at the conference, we were like, let's go eat some barbecue wings and watch Black Panther. But anyway, we digress. Tell us about the process of reporting that story. What goes into it? What's the first step? What's the second step? How do you sort of build it up?
Yeah, for sure. But before I get into that, I did want to, give my own in kind of person congrats to Julia for her Pulitzer. It's just super awesome to have a classmate achieve that, especially so like early in her career. So that's super cool. I remember when I was like a young SciComm slug, we would have like we'd go to some of these conferences and we'd see some like the alums and some of them would like hype each other up when an award was announced and be like, that's my classmate. And now here we are, like, that's my classmate. That's awesome. So now going into this story, so I wrote a story looking at colorectal cancer and its rise in young adults, particularly in people under the age of 50, with a particular focus on young Black men. So for me, I was fortunate in that I had a fellowship to work at STAT. Beforehand, I was freelancing and I wasn't actually doing much, COVID or really health coverage, but an opportunity came for me to join STAT's team through this fellowship and report on the intersection of race and healthcare, which is really what I wanted to do at that moment as, a journalist, in the midst of biggest story of my career, biggest health story of my career that had this intersection with race, through the disparities that we saw, through also the protests from George Floyd, as Julia mentioned. So I was fortunate enough to have this opportunity to cover a beat like this. Maybe like a week or so before I was supposed to start, actually about like several weeks before I was supposed to start, I was in my apartment. I was living in Palo Alto at this time, just scrolling through my phone, looking on Twitter, and someone posted, wow, it seems all young Black kids are just losing their heroes nowadays. I thought that was a little cryptic. I didn't know what the person was talking about. So I scrolled a little more and then I saw a headline from CNN saying Chadwick Boseman dies at 43, the Black Panther, as Seacon put it, like we saw that together, we were very much like Wakanda forever. He's an essential part of just kind of my being, my love for pulp culture, but also my love for Black superheroes. So to see him pass, I was really shocked and devastated, but it was personal for me in that I have a family history of colorectal cancer. My mom was diagnosed when she was 34. Luckily, she had a colonoscopy and they caught it early, so they were able to save her life. But that put me at high risk for colorectal cancer. And even though I've always had in the back of my head that this is part of, who I am, this is part of my, my health, my bodily health, I didn't really do anything to address it. I didn't really do anything, to really, to talk to doctors, figure out what I should do. But when I saw Chadwick Boseman die from it, this is the Black Panther. This guy's way more fit than I am, right? To see that this disease could take him out, that he could succumb to it, this scourge, I was shocked. I was just like, whoa. So part of my, so that's what really kind of honed me in on covering colorectal cancer. And part of that package, that story I did a feature story looking at these colon cancer hotspots in the US where young men under the age of 50 were more likely to die from this disease. But I actually underwent my own colonoscopy, which we famously videotaped, if you will. So yeah, that was a very personal first person story that I told. But to bring it back to where I was in that moment, I emailed my editor at Stat. I said, hey, listen, like this means a lot for me. I would like to do some kind of story as my project that lets me delve into this story, that lets me delve into this. And I actually had a conversation with them when I was brought on about how to tackle this story. And I remember my editor saying to me, like I said, I want to get my own colonoscopy. I want to go through with this, videotape it or do a photo essay, something on that, something to do to show people what this process is like. And they had said to me, Katie Couric did this. How would yours be different? To which I said, Katie Couric got a colonoscopy? I didn't know that. I realized I was 8 when she got her famous colonoscopy that she put on television. And that's when my editors, who were older gentlemen, looked at each other like, you know what, maybe there is something here. I also said I reach a definitely different demographic than she does as a young Black man. So we did that story, and then to kind of wrap up my answer here. My editors knew I was interested in this, right? So they had said to me, they sent a story my way on the guidelines for colorectal cancer being lowered from 50 to 45. And in speaking to the scientist on that, he said, yo, this is interesting, but I actually am mapping out these hotspots across the country where, young people die at this age. And you know what? Chadwick Boseman lived in one of these hotspots. And that's when I realized, oh, like there's more to the story here. That's when I kind of the feature came, and then I could talk a bit more about that later. But it was just learning that Black folk are 20% more likely to get colorectal cancer and 40% more likely to die from it. It just hit me. It really did, and it made me realize that this is a story I need to tell. And I was so fortunate to be at an outlet that allowed me to tell it in a rather unique way, if you will. So yeah, Sikan, thank you for the question. And all of this, in my story, I profiled a gentleman who had colorectal cancer. It's a very sad story, but he ended up getting treatment and everything like during COVID, and just navigating all of that and looking at all of these different barriers that are present in our healthcare system. It was eye-opening, and then to go through the process myself. But yeah.
Yeah, let's stay on it. What was the process like of sort of like building out the feature, with this gentleman, or just in general?
So it was interesting, right? In that I was looking for someone, a patient's story, to really build the narrative, to put a face to the data here. We've been talking a lot about data, and sometimes you can get lost in the numbers or the points in the graph, but every one of those points in this particular case on this hotspot map is a person, someone who lived a life. And it's so hard nowadays, with how many COVID deaths that we've had. I mean, many of us have experienced it, loved ones who we've lost to it. I know someone in the Q&A had posted about it, to which I send my condolences for your granddaughter. But I wanted to, have a central character for my story. So I went through GoFundMes. I went through a bunch of them to find someone who had died and lived in one of these hotspots. And I was lucky to have stumbled upon the story of Omar Carter. And I think GoFundMes are a great reporting tool, but they can be so draining as well, because you'll start off by looking and it'll say, hey, everyone, like such and such, our loved one is, beginning their battle with cancer. Oftentimes they phrase them as a battle, beginning their battle with cancer. Thank you so much for your support. We're going to make sure that they get through this. And then an update, hey, thank you again so much for your support. Things aren't, have taken a turn for the worse. They're not looking too good, but we're sure, our loved one will be able to power through this. We know they'll be able to. Just thank you so much again for your thought. And then a third update saying funeral services will be at, Sunday on this time and this time. And just seeing that case after case after case with colorectal cancer, especially young folk, people under the age of 50, because historically this is an older person's disease. It was heartbreaking, but I came across Omar's story and I was able to Google him and find out that there were some news stories about him because he was a bit of a local celebrity in that sense. So after that, I went on Twitter. I looked at the stories, the people who were quoting those stories. I found them on Twitter. I reached out to them and said, "Hey, can I learn about Omar? You know, your youth basketball coach. I want to know about his story to share this with folks." And they were able to connect me with his wife at the time, and I was able to kind of tell that story. So yeah, a lot of different types of reporting tools that came in there, but the most important reporting tool for me is just empathy, being able to really level with someone who lost a loved one, and being able to allow yourself to listen and allow them to open up so you can hear their story and tell it as it should be told. I feel, and you both, I'm sure, have this exact same feeling. You get this kind of responsibility as a journalist, especially in the beats that we cover, where you are entrusted to tell these super personal, sometimes heartbreaking stories. And, you know, we're just so fortunate that people trust us to do that, but it also means that, you know, we have to make sure we're doing a good job at what we are doing. So I'm just incredibly fortunate and privileged to have been in a position to write this story. So thank you for asking. That was a long answer, but
No, we got time. We got nothing but time. Julie, I wanna to hop off of that and also to loop in one of the questions that we received in the chat, and people feel free to keep putting questions in the Q&A. We have a couple so far. Marilyn says that her granddaughter died of complications of COVID. She was 17 and refused to be vaccinated. And she's asking what can be done to penetrate the misinformation that kind of surrounds COVID risk, especially for younger groups. And I'm asking you, given your work with New York Times Parenting and also New York Times as well, I feel like in all of our work, we try to find characters to try to get the policy and the data to stick to folks. But what do you find is kind of the tactics for reporting on these issues to kind of reach these folks?
Yeah, I mean, that's a really good question and something I'm not sure that I have all the answers to. Just being a journalist at the New York Times just alone, I think is, I think readers know that the New York Times is a credible place to come to for information. And, as just a general person, I think everyone needs to know how to spot misinformation and needs to know some of the red flags about things online that are not quite right, and so it's like taking a step back and saying, where is this information coming from? Is this piece of information too good to be true? Like, what's the context of it? Are there any gaps in a story? Are there mismatches between a story's claims and, the actual source material? And, are people that are talking credible? Are they legit experts? And so, obviously at the Times, we care a lot about credibility. And when we're talking to experts, we're making sure that the people that we're talking to have actual expertise. And that's one of the challenges of the pandemic is, I think, early on in the pandemic, the CDC and the WHO were putting out information that, turned out to not quite be true. They were saying, don't wear masks and don't wear, high filtration masks and N95s. And I think that sowed a lot of distrust among people, and some of the challenges for us is just trying to figure out who's an expert now. And before the pandemic, the sources that we would go to in journalism was like the CDC, the WHO, they were the experts. And then the pandemic showed us that like nobody was an expert. And, we were all kind of learning, we were building a plane while we were flying it. So I think it's been really tough, and like clearly the misinformation issue has spiraled out of control during the pandemic, and you can't really blame the people who are misinformed just because it's so problematic. But yeah, I don't know what the answer is to misinformation. I think, just for me, it's just always putting out solid work and making sure what we're putting out is true and evidence-based and is backed by research, and not elevating ideas or voices that are, haven't been proven.
Yeah, and today Well put out a story about just kind of like what people need to know about masks, right? How they work, do they work, should people be wearing them, given the news moment that we're in with the federal mask mandate being challenged. Like, what's the process that goes into that story? Is the idea just that we really want to meet this moment, or is it more about how do we sort of think the way that our audience member is thinking and address the questions that they might be asking? Like, what's that process like?
Yeah, I mean, it is looking at the news and just saying, like, what are the questions that readers would have? What are questions that we have? I mean, my first thought last night when I saw, everyone tweeting about the mask mandate being dropped on airlines and public transportation, I'm just like, I'm going to fly in a few weeks. Like, is that safe? Am I going to be safe if I'm the only one wearing a mask on the plane? Will I be okay? And that sort of drives, our coverage. If I have that question, our readers probably have that question too. And, a lot of it, that story that you're referring to is actually one that we published a few months ago. I think it was maybe last summer. And so it was basically just like resurfacing the file and updating it and just, saying, is this information still true? Because as we know, like, the information has been changing on an almost hour by hour basis in the pandemic. And so just kind of like taking what we've already written and saying, is this still correct? And updating it and putting it back out there. But yeah, it's, seeing what our readers want, going on Twitter, Twitter is a big part of that. What are people asking on Twitter? What is trending on Twitter? But a lot of it, and we also have reader feedback too. So we have a portal where readers can just write in with their own health questions. And so sometimes our stories come from that, and people do ask a lot about COVID. So yeah.
Cool. Very cool. Very cool. Very cool. I think a question for both of you, how has science journalism sort of evolved during the pandemic? Do you think, I guess some of these changes, are they here to stay?
I must say, and I guess I'm in part a result of this as well, but I think the increased focus on health disparities within our scientific science writing community, the increased focus of diversity when it comes to the sources that we reach out to, the communities that we cover, is definitely something that I feel that I've seen more of since the pandemic, when these racial inequities are just laid so bare to the point that you couldn't deny them if you tried. And seeing the inequities kind of built into our healthcare system. So I think a more of a laser focus that health inequities should be kind of incorporated in nearly every beat of health reporting, on medical reporting. That's definitely something that I at least feel I've seen in science communication and science journalism the past couple of years, whether that be bringing on new reporters to cover these beats, myself included, or seeing resources being poured in to report these stories accurately. That's one area I would say.
Yeah. One thing I think that's big is just that a lot of people who wouldn't have called them science journalists before the pandemic now kind of are. You know, the pandemic touches every part of life. Like every single journalist that was working in the last couple of years has suddenly became, you know, a pandemic reporter. It was every story. So, you know, politics reporters were suddenly health reporters, and metro reporters were suddenly covering the pandemic. So I think, you know, a lot of people who weren't really, you know, health and science experts in journalism suddenly had to become them. So I think that was one big change. And just, you know, kind of what I talked about before, where just, you know, who's the authority? Like everyone is learning on the fly. Like us as science journalists, we maybe had like, you know, a half a mile head start on understanding how to report this out. But really, we were all kind of starting from square one because there was no evidence base to pull from. There were no experts who had expertise in this and who we could ask about what was going on. You know, the experts didn't know what was going on. And, you know, I kind of had this moment where I was like in the middle of the pandemic and I was like, I can't even call who do I call? Like, I can't call the police. I can't call the fire department. Like nobody's coming to help us, you know? And I kind of had that sense with sources and experts, like everyone you would call up, they'd just be like, I don't know, you know, like who knows? So I think that was a big learning curve for all of us. And for science journalists is just like, reframing like what is solid information and, you know, and for us, like how to give guidance to people, you know, well as a service desk, parenting was a service desk. And so how can you give people solid guidance when there is no solid guidance?
Yeah, we all sort of became I feel like every scientist became like little like mini CDC, you know, in terms of vetting sources, you know, calling just way more sources than I think we did in the past to make sure that we could get somewhat concrete answers on things, or at least a semblance of understanding like what was sort of happening in the moment. I feel like it really the pandemic really placed an emphasis on why we need science journalists like in every newsroom in the country. You know, I think every newsroom is sort of set up that it has like its breaking news desk and then it has like its topic desks. And I think, you know, because events were evolving so quickly early on, you know, a lot of the early stories were from like a breaking news desk, and then sometimes it'd be like, oh, like this little thing is wrong, but then that really gets established in the public zeitgeist about with their understanding of the pandemic. And I think newsrooms quickly learned like, oh no, we need to lean on our expert desks to really get this story right. And I think that's a huge lesson going forward for, you know, say like a topic like climate change, right? Like I think we really just need environmental reporters in every single newsroom, because people are going to have thousands of questions every single day as like climate change continues to influence more and more of our lives. And so I feel like that's one way that science journalism sort of changed during the pandemic. I want to circle back to disparities, Nick, because you have a podcast for STAT called Color Code that focuses on the history of racism in the healthcare system and how it has and continues to impact people of color in underserved communities. You want to talk just a little bit about, you know, how that project came to be and how you're trying to get it to like fit this moment that we're in, because, you know, along with the pandemic, we did also have, you know, I think the reckoning over social justice. Can you just sort of talk about all of that?
Yeah, no, thank you for the question and for the plug. I appreciate that. Got my back, buddy. Yes, I do. I have a podcast now at STAT. We just had our third episode go up yesterday. It was about anti-racism at medical medical schools and such, and kind of how that effort has been really spearheaded by students, along with some educators, and kind of what that process is like. So yeah, the origins of color code actually, in a sense, do predate my time at STAT. We have a wonderful photo editor, Crystal, who, from my understanding, first came up with the idea that STAT really has been dipping its toes in podcasts, that STAT needs something on health equity in this space. And I believe it was an idea that had been kind of floating around for a bit. And then we were fortunate enough to get a grant from the Commonwealth Fund, which is one way that a lot of journalism at STAT is funded, through grants. So I had to write up a grant on kind of what this podcast would be, kind of envisioning it, looking at racism in medicine from angles that people might not be aware of, whether it be like bias in algorithms, whether it be looking at it from a historical standpoint. Our second episode was looking at a 1910 report known as the Flexner Report, which shut down 5 of the then 7 historically Black medical colleges at the time, which has had cascading effects on the Black physician workforce, if you will. And there have been studies that have kind of looked at that. But in terms of kind of pulling that podcast together, I owe so much credit to my team. We have a wonderful producer and a woman named Teresa Gaffney. There's Alyssa Ambrose, there's Hyacinth Empanado, and there's also our intern, Tino Demerced. And we all kind of just work together to it's a different type of form of journalism for what I'm used to. I'm mostly a written story kind of individual. But with the podcast, it allows me to really take the voices from the sources I'm speaking to and literally just put it right out there, so that you as a listener are hearing them. You're not hearing them so much just through my quotations or through my writing, my paraphrasing. You're hearing their voices. In some cases, you're really hearing their emotions. You're hearing instances where they went to see a doctor or went to like the VA and felt distrust. They'll repeat to you those scenarios. Our first episode is looking at medical distrust amongst the Black community, and how, as you put it, it's not just an issue of history. It's not just a Tuskegee this or a Henrietta Lacks that. It's issues that are happening today, where people feel like they are being gaslit by their doctor, or they feel as if people aren't listening to them or judging them when they come, and not being heard. Not being heard is one of the biggest things I'm hearing from so many patients who I've spoken to, as well as so many Black physicians as well, in terms of being questioned by other doctors to their judgment. Sometimes you'll have a family member who had bad treatment at a hospital, or horrific treatment in some cases, and that really can completely obliterate your trust in the medical system or in that specific hospital as well. And this is just one aspect of our flawed medical system, and this isn't really touch upon just the the wider instances of institutional and structural racism that people of color in this country deal with every day, and all of that compounds into like the medical into medical situations. It's just interesting. That's what I like about the podcast. You get the raw emotion. We have an episode coming up on Black maternal health, and it was just Black Maternal Health Week. Now, Black birthing people are 3 to 4 times more likely to die during childbirth than their white counterparts. And we kind of look at, why is that? Even when you're controlling for things like socioeconomic status or where people live or like educational levels, we're still seeing this gap. And it's one of those things where I'm privileged in speaking to the doctors who are experts in this field, but who are not afraid to really call out racism when racism is what's at fault. So yeah, in terms of just the origins of the podcast, super smart people at STAT wanting to do the project, and then telling me a bit about it and realizing that this really does align with my interests, even if it is a different medium for my journalism. But then also having an outlet that allows me to interview folks and let their voices not just be heard, but being heard unfiltered, if you will. It's been a great experience for me. So that's kind of how the podcast came together. That's kind of the mission we're trying to do.
And to spin off that question, and this one's going to be for the both of you. You know, it's like the topics that we cover can be persistently troubling. You know, I think journalism, like we're trying to often we're trying to expose like the people who need help, right? Like the people who are being left behind. How do y'all find joy in the work that we do? And then I'm going to ask a follow-up question to that. Like during the pandemic, how do you kind of find like the bright spots? Like how do you keep going like day after day while reporting during the pandemic?
I mean, for me, it was just, really believing in the mission of exposing the truth, and I think if I was working somewhere that, I didn't believe in the mission, if it was like, working for some company where the goal was just to make money for the company, I think I would have fallen into a hole of despair. But I think just, providing this invaluable service to readers, exposing light. At the time we had a president who was actively, trying to muzzle the CDC and sow disinformation, and there was nobody to trust really. And so this was the time for journalists to expose the truth and to tell things how they were. And so I think just talking to people, I would go out and meet people, and when they would learn that I was working on the tracking project, they would just be like, oh my God, I check that every single day. It's always up on my computer. I look at it constantly, knowing that I could potentially help save someone's life, people having real-time information about what's going on in their community. I think that's what kept me going, and just knowing that I was helping people.
No, that's incredible. And you most likely certainly have saved lives, and that's an amazing feeling. That's wow. When that kind of hits you. To answer your question, Sikan, for me, it's that moment when you realize that a source has really dropped their barriers, dropped their walls. It is being open with you and is sharing, very personal things about their job, about what they're going through in the healthcare system. And they're sharing this uninhibited because they know you're listening. They want someone to listen. There's just this moment, this kind of connection you get with a source. I've had it when I'm speaking to doctors who are just really trying to get through to people about how devastating it is in hospitals, how stressful it is, how it is to literally, put a tube in someone's mouth, how it is to communicate to folks that, your loved one is probably not going to make it. And having to deal with this while there's still all this layer of like disbelief, as in like, no, this isn't really happening to me. This isn't going to happen. But the doctors who are seeing this day in and day out, and just realizing the burnout in them, and realizing that you, whatever kind of level you can do, because there is only so much that our words can do, but knowing that you are helping them by doing the work that you come in every day to do, that you wake up every day to do, that your work has meaning. Yeah, I find joy in that. I certainly find joy in that. And even though I get off phone calls, I'm sweating, sometimes I'm crying myself. And then the responsibility sets in that I alluded to earlier, knowing that, wow, now I have to turn this into a story, or now I have to bring this into my podcasting script. but realizing how privileged you are to be in a position to share that person's story. That brings the joy. I would certainly say that brings the joy.
Yeah. Yeah, and I think for me it was two things. One was sleep. I think I think 8 months or 9 months into the pandemic, I realized that I had to force myself to have better work-life balance in order to kind of like perform at the level that I wanted to perform at. And I think like it's very easy, especially like early on in our careers, to just like go and go and go and go and go and go. And I think the pandemic pushed us even further into that cycle of like going, 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 going. And I remember, just like one night in like August, like 2021, I was just like, I can't do it. Like I gotta pull back a little bit. Or no, August 2020, I got to pull back a little bit. And so that was one big thing for me, is like just like coming to that realization. I think the other thing that sort of has brought me the silver lining of the pandemic is holding, I think, like our elected leaders accountable for the decisions that they make that influence people's lives almost immediately. Is a really, really big one for me. We've been conducting sort of like an ongoing investigation into ventilation in New York City schools, and how the city ended up purchasing air purifiers that lack HEPA filters, which I think most people by now know what those are, or that also do not clean the air as fast as most air purifiers that you can purchase on the market. Like how the city ended up sort of purchasing subpar air purifiers for all of its schools. I think getting to that information, even while the city tried its best to keep us from that information, and also showing an effect in schools in terms of case levels. I think after we put that story out, there were a lot of parents who reached out to us and were like, I just knew something was happening with our school in terms of ventilation, and there not being enough resources. But we just weren't getting a whole lot of information from the city. And I think like receiving messages like that, sort of refills the tank to keep you going.
To add on to the point you made about holding, people in power accountable and such. If there's one thing I hope comes out of this pandemic that we're dealing with, that we've been dealing with, that we will continue to deal with for the foreseeable future, it's realizing how science can be attacked by people in power, and how it has long been attacked. And I'm drawing this comparison to climate change. I hope we have now a generation that sees that when it comes to like climate change denialism, that it's like, no, like it's like we saw right in front of our eyes, people in power lying to us about the pandemic, like literally lying to us, like trying to manipulate the science. And then you realize like that's what's been happening with so many other issues, especially when you have big industries involved in it. So I'm just hoping that going forward, enough people realize this, see this, have lived through it. Because I kind of feel like the pandemic, obviously with it being such a big and devastating story within itself, but it's kind of been like, from a science nihilism standpoint, from a people in power, protecting their assets versus the protecting everyone else standpoint, it's kind of been climate change on like a shorter scale, in a matter of years, in terms of seeing people trying to befuddle, muddy the science and such for their own profit. So I'm really hoping it, if there's any sort of silver lining to it, that it helps further energize our generation when it comes to this battle for our planet, and this battle for a habitable planet for us humans, for all of us humans, not just those with money.
Yeah, not just for the ones who can build like castles on the top of mountains to escape sea level rise. Julia, I don't know if you wanted to touch on that too. Otherwise, I'm gonna open it up to the Q&A, but I don't know if you got anything you want to say about that.
No, let's get to the Q&A. There's some good questions in there.
Let's do it. All right. Yeah, you can continue to put questions in the Q&A function right now. Let's start with, where do I want to start? Start with Petra. Petra, you put a question in. It was, I think it's sort of directed to me, but I think we can kind of open it up to everybody. I mentioned, hoping too much for the best during my Omicron situation. You said that Petra, you said that you were studying for your veterinary boards and preventive medicine specialization. That you just read a paper on food safety and optimism bias. I do enjoy a paper on bias and all things psychology. And so you're asking us, how do you not, sell an idea with fear, but use science communication to educate people so that they can change their behaviors for health? Whether it be wearing a mask, testing appropriately, washing your hands, or not using the 10-second rule. I'll start. I feel like, I don't go into any news story saying like, oh, like I'm gonna change people's behaviors. A concept that I speak about a lot is like the weight of evidence, and just sort of expressing how much evidence is behind maybe multiple ideas related to like a certain topic, right? So, I think there are folks who feel that masks are having some type of effect on children's abilities to learn language, and they use that as a way to say that, oh, people shouldn't be wearing masks. And then maybe they loop into that conversation. Oh, like, no, the masks aren't that effective anyway. I think when I did a story about that a couple of months ago, one thing, like a few things that we did was we just laid out like, here's all the evidence around the efficacy or the effectiveness of masks, whether it's how they block particles, what we see in terms of case rates when people wear masks in different situations, and just like spelled that all out. And then we looked at, okay, what types of studies have we seen around masks and language, or like what do we know about language learning in people who can't see, right? People without sight. And I think when we look at that evidence, it doesn't show much of an issue of not being able to physically see somebody's mouth when it comes to learning a language. And then I think you also talk about the issues around, I think, education and social education over the past couple of years. And the questions that we might have about kids falling behind. I mean, I think you can't only isolate masks and their influence in that situation. I mean, I think remote learning, I think having all of our interactions sort of compressed down to 2 dimensions instead of 3 dimensions. I mean, I think a lot of those things are probably having, a larger impact or an impact versus just having a mask over our faces for some parts of the day. And so I think when you sort of spread out all the evidence like that, I hope people sort of see that balancing of the scales, and they can make decisions for themselves. But I think in terms of influencing behavior, that's not really what we're going for, because because I think also like audience members referencing, news outlets that I think peddle a little bit more in opinion. Like I think audience members can quickly sense when something is trying to influence the way that they think, and like they can, they're not necessarily drawn to that, in my humble opinion, all the time. Anybody else have thoughts on that one? Sorry, I feel like I just like soapboxed for a little bit. Okay, Julia, there are thousands of counties in the United States. How did the New York Times go about collecting COVID data from all those entities on a daily basis? I mean, I know we do it now, right? Like CEC is like mostly functioning these days. You can go to their website, you can pull like the county by county data now, but in those early days, how were you sort of assembling it?
Yeah, so it started literally with a spreadsheet. It was one spreadsheet, and this reporter, Mitch Smith, who is a reporter for the national desk, he kind of started it, and his job was to literally like track all of the cases in the United States, and it was manual. It was like, the governor of Kentucky is doing a press conference right now. Let's listen to that and like listen to how many cases they have there and put them in the spreadsheet. Go on Facebook, a county in California is reporting, 10 cases. Let's put it in the spreadsheet. And so it started really as a manual effort. We hired dozens of stringers, reporters across the country, and a lot of them were college students or like recent college grads who were trying to get into journalism, and we just hired them. And literally, it was me and about 4 other editors were directing this team of stringers and just saying like, okay, Matt, you take all the counties in California and like listen to all the press conferences and go on all the Facebook pages, and like it was literally just manual entry into a database. And then eventually, obviously that became impossible. The database crashed, the spreadsheet crashed. There was too much information. And so, a team of very talented developers at the Times, and also outside of the Times, I think we hired some freelance developers, devised what are called scrapers, and they're basically just programs that would scrape the web, all the government and county websites across the whole country, and just automatically pull that information into the spreadsheet about every 15 minutes. And so all the information would come in, me and the other editors would sort of, fact check it, make sure it was okay. There were always issues with it. So that was really hard because it was data coming in from the entire country. And then we would publish it to the website. So it was really, in those early days, it was manual and scrapers, and, the scrapers took a while to come online. And so it was really a manual effort. And I also worked on the nursing home tracking project and the college tracking project as well. And that was literally calling every single nursing home in the country and every college in the country and sending them emails and ask, because they weren't required to report this information to anywhere. And so, we were filing FOIAs, we were, freedom of information requests. A lot of colleges didn't like that we were asking them how many cases they had. A lot of places were trying to keep this information secret, and we got lawyers involved to get that information. But it was literally like, we had a list of every single institution, nursing home in the country, and we just went to all of them and found that information and manually entered it into the database. It was an incredible project, amazing, and just, such a huge effort. Like over 100 people worked on it. So it was incredible. But now, yeah, it's mostly it's mostly automated. I think it's mostly automated now. I haven't been on the team in a while, but we're not pulling the CDC data. We are still using our in-house, scrapers, which is incredible.
Yeah, just in case the CDC goes down again at some point.
Yeah, and also, it was challenging because everywhere was reporting data a little bit differently. The CDC data actually wasn't quite accurate and up to date, and it was challenging because some counties were classifying a COVID case differently than another county, and so it was just very challenging to sort of collate all this data and compile it all into this readable database. But it was incredible.
And then the next question we have is from Gary, and we're going from big COVID tracker to like daily news story. The New York Times has a strong emphasis on accuracy. What is it like to fact check a breaking scientific news report on a short deadline?
It's hard. I mean, as I said, it's hard to know what to trust. I have to have a lot of trust in our reporters. We work with a lot of freelancers, and sometimes it's hard to tell, how strong their reporting skills are. So, not only do I become, a words editor, a story editor, a copy editor, but I'm also a fact checker, and I literally go line by line in the story and just say, how do we know this? The reporter has to have sourcing for everything that they write in their story. And it's really hard to do it on deadline. The Times prides itself on being the first, anything. If we get really upset when the Journal or the Washington Post has a story before us. So, it is that dance between making sure things are accurate, but also getting things out quickly and with speed. And it's hard, but it's literally just, looking at their sourcing and a lot of Googling. If someone looked at my Google history, they would think that I was insane because I Google the most insane things, but yeah.
And I'll just remind folks, if you have questions, feel free to put them in the Q&A box. For both of you, how did our training or your training, our training at the science communication program, kind of prepare you for the journalism landscapes that you're currently in?
I would say one thing that I have found particularly useful from my time in the program, back in the old days when Julie and I were interning at the Monterey County Herald, I remember I would have stories and my editor would say, okay, like kind of like what Julia said, like, how do you know this? Okay, call up the source again. Like you got to make that second phone call. You got to do that. And, that's super useful. Sometimes when people are reporting stories, especially like earlier career folks, they feel like one call to a source, and if they have to have follow-up questions, they didn't do it right. They didn't do the journalism right. But to which I always say, because I also help run our internship program at STAT, I say, no, that's journalism. Keep calling them back. Keep doing it. Keep making sure you're getting things right. A big thing I got from may have been from SciComm, but just like my fact checking process in terms of like, how to ask sources, like, is this fact accurate? How to do this and how to do that on deadline has been super helpful, because I also very much, pride myself in accuracy. Accuracy is the most important thing to me. I don't know if you all remember that Paul Rogers line. Accuracy is very important to me. And I use that line in every single interview I do, because I want to make sure I am getting my facts correct. And if I'm not getting them correct, then we're able to correct them with the accurate information. So I think that's definitely something that SciComm has instilled in me, just, double checking your facts before you put it out there is it's important. It's important for any journalist to have, but also SciComm's super collaborative in that sense. And I think that also helps you as a journalist to realize that, yeah, there are moments to be competitive, but there are also moments to, work together. I mean, Julia's, her work is a prime example. Like over 100 reporters like working together on a singular goal there, and that's definitely something I felt like camaraderie in journalism. I got a lot of working with these folks over at SciComm, and it's something that I try to instill in not just the people who I mentor or the people who I work with at Stat who are early career, but just in myself as well. Like, how can we best collaborate on a project? How can we work together to get a goal that gives our readers and gives other folks, the most accurate information that they need, that they care about, together. So.
Yeah, I agree with everything Nick said. I mean, I think the program taught us to be just skeptical, and not take anything at face value, and really make sure that what we're saying is accurate. And even, not even experts shouldn't be trusted sometimes at face value. I've had a reporter recently who quoted a dermatologist as saying something, and I was just like, how does she know that? How does this dermatologist know this? And the reporter was like surprised that I asked, because she was like, isn't that an expert? Like, that's an expert, and it's like, even questioning the experts, you have to push back basically on everything. And yeah, I think the program also taught us how to use data. There's a big emphasis on data reporting and using spreadsheets, and that definitely helped me in my massive spreadsheet that I had to work with on the COVID tracking project. And also just like different forms of storytelling. The program really emphasized audio and video and photography, and using infographics to tell a story. Like, every story doesn't have to be just words on a paper. It can be told in really visual ways, in different compelling ways. So yeah, I've said this a million times, but the program definitely, I wouldn't be here where I am now if it wasn't for the science communication program. And that's not just a plug for the program, but I truly feel that.
They're alums. I don't know if they need more schooling, so they won't take it that way.
Yeah, I agree with everything else said. I think for me, my big takeaway from the program was craft. I just think like how our instructors emphasized the language that we use, how we reach people, the analogies that we use, like the power of helping our readers visualize something like a very complicated topic. I think was huge for me. I think that was the big thing that I got out of it, outside of y'all, my friends forever. Let's see.
If I could just jump back on that question, because
Sure.
something hit me.
Yeah, go for it.
Kind of came in my head, but also through the program, realizing that I'm a very enthusiastic person, and kind of leaning into my enthusiasm. The program has definitely, it helped me do that, but also realize that's okay. And I'm thinking of like a specific memory where an older journalist had said, like, yeah, Nick's great, but like, he's too enthusiastic about things and such. And that had really gotten me down for a bit. And I remember, I don't know if Julia remembers this, but I had shared it with her, and she was like, more or less like screw that, just be yourself, like be your enthusiastic self. And I was just, and that's actually something that's stuck with me for a while, just be you. So like those kind of interpersonal moments that happen at when you're in a cohort like that can really help you, or just like be part of who you are going forward. Yeah, that's been cool. And I mean, also just like growing and watching your colleagues, like just everything CCon's been doing as like an editor has been so cool, and like watching from afar, but also kind of from a close, but also from afar, and be like, yo, that's my man. Like, look at him, he's doing that good work. And that also gives you the drive to want to do more work and like continue doing, that kind of stuff. And also like, I already said it to him, but like props on that COVID story when you had COVID, because I got COVID and I was like, I cannot write anything. I told my editors, I was like, I'm out for like a week. I'm not doing a story on this. So yeah, props to you for pulling that off.
Yeah. All right, nobody can stop your sparkle, Nick. Step one. But no, I think what you said is spot on. I mean, I think newsrooms are very particular spaces. They can be very insular spaces. And then I think you have, these desks of essentially science experts trying to explain to the world how the universe works. And it can create friction, because I think science news is its very own special particular brand of news. And so I think a great part of the program is just having 10 9 other folks that you're with. I was thinking of class hijinks was our nickname. 9 other people that you're with that you can really bounce ideas off of. You can really emotionally grow together in this profession that we've decided to take on. And then
and it's also wild that we all like ended up covering like COVID in our own various ways, going from being students together in that classroom to like the big leagues in that sense for like major outlets. Like that's still wild, right? That's like started from the bottom, now we're here. It's really cool to share that with you all.
Yeah, I mean, at National Geographic, it was funny or not funny. I don't know what the great word for it would be. But I started there 2 weeks after the first COVID cases were announced in China, and then they don't have a whole lot of health editors at National Geographic, and so they're like, oh, you have you've done research on infectious disease. Why don't you just like cover this for a while, because we don't know how long it's gonna last. I'm laughing because I feel like at first I was like, it'll probably be like 2 months, we'll be done.
By Easter.
By Easter we'll be good. And it's just kind of like you say. I think we all kind of were thrust into this moment, but because we have the backgrounds we have in terms of our familiarity with being able to read studies, converse with scientists in a way to both expose their knowledge, but also expose their passions around science. It became a really, I don't know, just like I think we're going to be talking about the moment that we all just lived through, probably for the rest of our lives, in a professional and emotional mental sense. Erica's back, because Erica is gonna see us out. Erica, do you want me to? I have a question that I think will be a good alley-oop.
Sure, go for it.
For us. All right, Nick, Julia, and then maybe Erica. What advice do you have for students who are interested in pursuing science journalism as a career? Whether they're in high school or they're in college or they're finishing up their master's or PhD, what advice would you give them?
I mean, I would say just start doing it, just get out there, start writing, whether it's personal for a blog, if blogs still exist, I don't know if they still exist. But if it's, for Medium, like anywhere that you can write and publish work, if you can find an editor that is willing to take a chance on you and work with you and sort of mentor you, I think that's really valuable. Having a network of other friends and colleagues, people who are also starting out in journalism, I think is really helpful, that you can like bounce ideas off of and get people to read your work and ask questions, and then just read a lot of journalism. Like if you have favorite science publications, just read them a lot and like literally dissect the stories, like annotate them in the margins and think about how those stories came together, what kind of reporting had to go into them to be written, why were they structured that way. I think the more you can read, that makes you a better writer, but it's really just starting to do it. I mean, when I entered the program, I had a blog, but like I had never published anything anywhere. And the program really just like forced me to I was terrified of writing, and it just forced me to do it. And that's what gave me the confidence to become a journalist.
That's
Nick, what about you?
fantastic. I'll take that alley-oop. Yeah, I mean, whenever I give advice to people who are interested in science journalism, I kind of give it twofold in that I want folks entering this career to come in with realistic expectations. As people like to say, you don't do journalism for the money. I remember in grad school, Erica used to say, because she married a journalist, and she would always joke to us like, why couldn't you have been a doctor? Marry a doctor. I don't know if you remember those. Those are always funny. And it's like, now that I'm like a journalist, I'm like, I understand. I understand. It's definitely something where, coming in with realistic expectations, because it's not, the best paying of professions. So keeping that in mind when we say stuff like that, like we mean it. There are definitely folks in our, Julia's over at the Times, and I remember I had a colleague at the Times who used to say, you'll never find a place with smarter people who are paid like much less than what they're worth, is what he used to say. But the good thing about journalism, especially science journalism, is that it really gives you this opportunity to follow your curiosities, whether you want to know more about the cosmos, about space, whether it be insects, whether it be infectious diseases, whether it be, just like astrophysics, whether it be any of these things, you have the opportunity to explore that. If you're the kind of person who loves to learn, always learning new things, like this is a fantastic career path for you, because you're more or less given kind of free reign to call up whomever you want, have a conversation, leading minds on this planet to learn about these facts that you want to write about while you're exploring the kind of stories you want to do. But you also have, as I think we've kind of hammered in throughout this conversation, you have the privilege to have this kind of responsibility where you can tell people's stories, or you can help tell people's stories, and you can use that to really try to make change. You can use that to amplify causes, or to amplify disparities, or amplify, as I was saying, like the voices of people who just in many cases aren't being heard or listened to, and just having that privilege, having that ability, having that license, having that that passion to be able to share this kind of knowledge with the world. It's unmatched. It really is. And it's part of why I love what I do. And it's also super cool. I mean, we didn't get into, I love dinosaurs. Every now and then I get to write about dinosaurs, and such. Super cool. Not everyone gets to do that kind of stuff. So yeah, science journalism, it's really fantastic, especially if you're a curious person.
Yeah, and for me, the thing I tell folks is, because typically I'm on a panel like this one, is that you look at us, like we all have jobs. I mean, I know that the demise of journalism, I think, is a bit exaggerated at times. I think the industry is constantly evolving, as many of our industries do. And I think there will always be value in exposing what's going on and helping people understand objectively what has happened after a certain event, or with a certain study, or with a certain environmental disaster. I think the pandemic has exposed the value of why we need science journalism. And, in a way, it's also prepared us for the next pandemic, because, I think it is going to happen within the next 10 years, 15 years, 20 years. And I think newsrooms are probably in a much better position to cover that in terms of what to watch out for misinformation, what type of information people need. And as I said before,
why are you making a prediction like that? You're already 1 for 1.
I don't know. I mean, if you look at the cycle of major flu pandemics. We don't want to talk about it. We don't want to talk about it. But yeah, or if it's with climate change too, right? Like I think I was just speaking to like a high school class a couple of weeks ago, and I said, climate change, as devastating as it's going to be, it's also it'll be like an unbelievable opportunity for journalism, because there's just going to be so many stories to tell, and people really, really need information. And so, I think young generations are especially in a position to change journalistic storytelling and mold it in a way that we probably haven't seen it happen, whether it's for print or whether it's for TikTok or whether it's for whatever platform comes next, maybe like plugging neural implants into our brains and just getting all types of cool holographic images projected in front of us. Trademark. I just think that it'll be a really, really fascinating time for years to come. And Erica, over to you.
Well, I will add one thing to what you've all said, which is that where our program is unique is that we take people who have science backgrounds and we give them the tools to communicate. So a lot of times what I'm seeing in the people who come to the program is a real understanding of what the field is like, but also a real drive, a sense of purpose that they want to make an impact on these types of issues. Climate change is a huge one, but inequality in the sciences, inequality in healthcare, all kinds of health issues. And I think that these are people who are highly motivated to translate research into action. That's part of what we do. And part of the reason why we're able to do this is because, we have generous fellowships for the students who want to come through the program, because we recognize that they've all had prior training. They're going into this career field where, they might not make as much money with their PhD as they could somewhere else. And so, we want to make sure that they're in the position to make the biggest change. So that's a plug for our program and for supporting our program in any way. If you can, it's a huge help to producing journalists like these who are, leading the conversation on these major issues. And with that, I would like to thank all of you who've attended. It's been such a pleasure to share this conversation with you all. I'd love to thank our panelists, Sikan and Nick and Julia. It's been so fun listening to your conversation. So great to just, especially for someone who worked with you guys very early in your career, to see how much you've grown as journalists and people. Such a pleasure. So thank you all for joining. And with that, I will sign off and say goodnight. Bye, everyone.
Take care, everyone. Stay safe.
Bye.
Bye.